Coming from Bruce Willis's family today, the famed actor has been diagnosed with frontotemporal dementia, also known as FTD.
Joining us now live is Dr. Armin Fesharaki, a behavioral neurologist at Yale. Doctor, thank you so much for joining us tonight. First off, please, if you could, explain the difference between aphasia and FTD.
First of all, thank you very much for having me. It's a pleasure being here. So aphasia, by definition, is a difficulty with production of words. So there are different types of aphasias, either different difficulty with accessing words or producing words. That's what aphasia means. Frontotemporal dementia, as the name suggests, it affects the frontal lobes and the temporal lobes. And it's very much folks with FTD can have personality changes. That's what the frontal lobe is involved with, as well as memory issues over time. So there are subtypes of aphasia patients can progress into FTD, unfortunately, also.
And Doctor, that was my next question. I was going to ask you, how does FTD present itself? What should Willis's family know?
I will not make any specific comments about Mr. Willis's family because he's not my patient, of course, but I'm happy to speak about FTD in general. FTD hasn't had a lot of publicity, I should say, up to this point, so I'm glad it's part of our conversation right now. FTD below the age of 60, so folks that are younger than 60 years of age, is the second most common type of dementia. And it starts from the frontal lobes, as the name suggests, and these are the patients that develop a lot of personality changes, so their behavior starts to alter over time. It can be devastating for the family members to kind of witness these behavioral changes over time. Unlike Alzheimer's, that kind of presents with memory issues, with FTD, typically it's the core personality that starts to morph in front of the family's eyes, which can be devastating. And as it progresses,
Finally, about 15 seconds, what does it mean to live well with dementia?
That's a great question. So having a support community around you, and I did want to just mention briefly that AFTD, that stands for Association for Frontotemporal Dementia, having these networks around the patients is very important. And also being involved with the research. I'm also involved with synaptic density study research looking at FTD patients. So it's really important to be involved with academic research in the community, being involved with folks that are suffering from this disease also. So having that network around you is essential.
Dr. Armin Fesharaki, behavioral neurologist at Yale, we appreciate your time and expertise tonight, Doctor. Thank you. And if you or a loved one is struggling, you don't have to go through it alone. The Alzheimer's Association has a national hotline. It's staffed 24/7. You can reach out to them for support. The number is on your screen. It's 1-800-272-3900.